everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. For those of you that are coming back here again, welcome back. And for those of you that are new, welcome here. So the way that these webinars work, and this is more of an explanation for those that are new here, is you'll notice that I had muted all of you when you arrived tonight, and I'd like you to stay muted unless I need to ask you a specific question or unless you want to ask a follow-up question to something we discuss. Okay? That way everyone's not hearing your background noise, basically. And the way that these webinars work is I have you write your questions out to me in the chat box, and I work through as many of them as I can. I usually am not able to get to all your questions. I just want to be honest and straightforward about that. The reason I have you write your question to me is so that everyone can see it and also read along with us at the same time. So that's how we'll do it. Now, one thing you'll notice though is that after I discuss somebody's written question, and I may even ask them specific questions about it, then I ask people if they have a follow-up question to what we just discussed. And I need to clarify that. That's not the time to jump in and get a new question in entirely, okay? It's only supposed to be a follow-up question to what we just discussed, okay? So I ask everyone to try to abide by that as much as possible. And if you don't, I'll just tell you, I'll remind you all about that, okay? All right. I am creating a recording of tonight's webinar, and tomorrow morning you will get an email from me somewhere around 9:30 a.m. Texas time, Austin, Texas time, notifying you that that is ready to be seen. If you happen to miss it, though, just realize that all of those videos, how you see those videos, you can access through the Q&A webinars page at Marty Ross MD Supplements. Okay, so if you don't get the email, just check back in the morning. You'll see that I've got it posted up on the Q+A webinars page at Marty Ross MD Supplements, and I'll show you that all later tonight too as well. Okay, so I think that pretty much covers everything. And then just a quick message to you, Ken Nixon. I see you there. I know I didn't get back to you this week yet. I will. So don't worry. I did get your email, and I'm sorry, I just been tied up with a number of things, but I will get back to you about that. Okay. So I just wanted to let you know that.
Appreciate it.
All right, Ken. All right. Okay, so without any further ado, let's go and get started. David Cecil says, "Good afternoon from Chico." Good afternoon to you too, David. I guess we've creeped into the evening hours here in Texas, though. We get rid of that. And then next comment in question is from James. I think it's Triano. I'm not sure if I'm quite saying that right. But anyhow, James says, I would like to thank you for being profoundly generous with your time and knowledge. You're welcome. There is no parallel for what you do. You have undoubtedly helped countless people with both your Zoom forum and website. Yeah, I thank you. I do get feedback pretty regularly, so I know I'm helping, and it's one of the things I like to do. I like to help people, so I have this knowledge, and I figure I can share it and try to fill in for some of the gaps, especially in our country and countries across the world where there's just a shortage of people helping you to manage tick-borne illnesses. So I'm glad to help out. Let's see, my wife was diagnosed with ALS last year. Your suggestion she tested for Bartonella and tested positive via IGenex fish test a month ago. We greatly appreciate that suggestion. I have a few questions regarding Bartonella. How reliable is an IGenex fish test in terms of positive result? We had a consult with infectious disease nurse practitioner at ILADS who dismissed the fish test and stated the PCR is the gold standard. He stated the fish is unreliable. Given a positive IGenex fish test, should we regard the Bartonella as inactive growing state infection as opposed to a persister state, or as an active growing state as opposed to a persister state? And three, should we still be treating Borrelia and Babesia while treating Bartonella? Thank you. Okay, so in terms of the fish test, the fish test, the way that is done is we take your blood and we smear it on a microscope slide, and we take a fluorescent probe that attaches to the genetic material of the germ. Okay. Now I want to, and then if we can see it under the microscope, we can see it because it'll light up, right? Because the probe will be stuck on the genetic material. All right. By comparison, the PCR test that the nurse practitioner talked about is another way of measuring whether you have the germ DNA in you. All right. And it's just a separate way of measuring it. We measure, do you have the DNA? We don't actually see it under the microscope. So I'm not quite sure why she's saying PCR is reliable, but a fish test that relies on looking at the DNA is unreliable. That makes no sense to me at all. And which tells me she's probably just not familiar with the testing technique. Both the PCR method as well as the fish test, the greatest chance of unreliability is they can sometimes be unreliable at finding the infection when it's there because the germ literally has got to be in the sample of blood that's drawn, and the Borrelia or Bartonella doesn't readily live in the blood. Okay, so the main issue is a sampling error resulting in either PCR or fish testing showing a false negative result. Okay. But you can't deny when you've taken a genetic tag, a fluorescent tag, that is only made to attach to the genetic material of the germ and it lights up on the microscope, that's a positive test. There's no way that can be false. So I disagree with her. Okay. Um, and then in terms of whether that tag is designed to see active or growing state versus persister, there's no difference in the genetic material in an active or persister germ. So it's not designed to say whether it's active or persisting. What I will let you know is at any one time, you have both some germs that are in an active state growth state and some that are hibernating or a persister state. Okay. And looking at some laboratory experiments that might suggest that active germs, actively growing germs, non-hibernating germs, and this is both for Borrelia and Bartonella, maybe make up about 90% of your germs, and about 10% go into these hibernating states. Okay. So that's just based on laboratory studies. All right. And then if your wife has both Borrelia and Babesia, I do also think they should be treated. All three can lead to neurologic problems. Of the three, though, Bartonella is the one that causes the most aggressive problems from a neurologic standpoint. Generally, what I do in situations where a person has all three is I'd like to start my treatments by going after Bartonella and Borrelia at the same time. And once a person is starting to show some improvement in Bartonella symptoms, or about 2 to 3 months in, I hope you heard the word or. If you're not seeing any improvements, or about 2 to 3 months in, then I might add in treatment for Babesia. And yes, you could treat all three at the same time. There's ways to do that. You can treat all three at the same time. Okay. The thing you got to be careful with, James, and I think you know this, is especially with ALS and also multiple sclerosis, Lyme, Parkinson's, Lyme, these things that have more severe neurologic presentations, we have to be careful because we can literally, and being very aggressive with our germ killing, we can topple a person over. We can cause so much of a Herxheimer inflammatory response that it makes their underlying situation a lot worse. So you've got to, being aggressive may not be always the best way to go. But when she is stable enough on treating for two and about 2 or 3 months out, then you might go ahead and add in the treatment for the third germ at the same time. Okay. All right. So James, did that answer your questions for you there?
Yeah, it did. Would you mind if I ask just one quick follow
Yeah.
up on this topic? So, to your point regarding, overloading a person, especially a person that may have some sensitivities to medicine,
Right.
would you recommend a lower grade approach like a Japanese knotweed cryptolepis combo for the other two while the Bartonella is the focus?
You can make an argument for that. The one thing I would tell you is generally most of the prescription antibiotics that we recommend for these illnesses have some evidence of crossing the blood-brain barrier. Okay. And in your wife's, the ALS is affecting the dorsal root, so that's still within what's called the brain barrier, even though it's not the brain, but it's still part of the central nervous system, right? So herbal antibiotics, although I have observed great things with them, we don't have any science that tell us for sure whether they cross the blood-brain barrier. I just want you to know that, okay? My working with them, though, would suggest that all of the herbal antibiotics that I've written about and we've talked about here should cross over the blood-brain barrier because I've seen good results doing it, but I just need to make you aware of that. We don't have the scientific evidence on that. But yeah, you could make, especially somebody that's sensitive, you could make a statement for going for like, if you can find it for your wife's situation, like a methylene blue diflucan, for instance, as you know, I've mentioned that as a good Bartonella. It's also a good Borrelia treatment, to be quite honest with you. And then going herbal for your Babesia, you could do a cryptolepis for your Babesia if you wanted to. That would be a way to go. Yeah.
She's on azithromycin and rifampin
Okay.
combo.
She's on a good Bartonella treatment then, and that azithromycin rifampin actually I consider to be so that treatment, just so you know, is good for growing Bartonella, growing Borrelia. So the rifampin can pick up um, growing cyst Lyme, can pick up intracellular growing Lyme, and can pick and then the azithromycin picks up spirochete and intracellular growing Lyme. The trouble is with just those drugs, though, they're not doing anything for persisters. And what you might consider adding in to go for persisters, which I like, is the liposomal cinnamon or a product that has cinnamon, clove, oregano. And there is a product called liposomal cinnamon, clove, oregano that has all those in it. Those herbs independently studied are great at treating both growing, persisting, and can get up biofilms in Borrelia and Bartonella. Okay. The clove that's in that cinnamon clove can also have some antibabesial properties. It's not the strongest thing, but it can have some antibabesial. So, a couple months you could add in a cryptolepis, got a good Babesia treatment, and that crypto is also useful for growing and persister Borrelia and Bartonella as well too. So you get some help from that too. Okay,
Thank you very much.
a lot of moving parts. Good luck. Yeah.
Thank you.
Does anyone have a specific follow-up to question to what James and I were just talking about? Not a whole new question, but just what we were talking about. All right, let's go ahead and move on here then. Good luck, James. Hello, Chris. Let's see. Hello, Dr. Ross. As always, thank you for being so wonderful. You're welcome. Thank you. How long should a person with chronic 15-year Borrelia, Babesia, and Bartonella take Dr. Bruce Patterson's protocol of Mir I always say this wrong, Miravorac and a statin? Studies on long COVID patients and Miravorac report improvements in 6 to 12 weeks. I haven't seen studies about chronic Lyme patients in Miravorac statin. She has been on Miravorac since November 24, and she has felt improvements, but also started methylene blue and Aracoda at the same time, so it's hard to know which one or all three are causing the gradual improvements. She is having more intense Babesia symptoms, especially drenching sweats, for about 3 days after her weekly dose of Aracoda. So, my experience, Chris, I've had mixed results with Dr. Patterson's protocol of using Miravorac and I think it's simvastatin. I think that's the statin that's used for long COVID. But I have practically seen no benefits of it in chronic Lyme. I know he advocates that he can see with the cytokine testing he's doing, he can tell whether there's a fingerprint that says long COVID is active or there's a cytokine fingerprint that says maybe this is Lyme. I just have not seen good results on the Lyme side. I get maybe 50%, maybe 30% of people may have had benefit on the COVID side when they were just pure COVID and not long Lyme, but I just don't find it that useful. My suggestion would be if you haven't seen much major improvements after about 3 months, or even for long COVID, he would suggest, I think, that 3 months is adequate treatment for long COVID. If you're not seeing any more improvement happening after 3 months, I would think it's time to retailor your treatment to actually focus on the underlying chronic tick-borne infections using treatments other than the Miravorac and the simvastatin or whatever statin that you're using there. Okay. And then, the methylene blue is going to be good for treating growing and persister Bartonella and Borrelia. It's also good against Bartonella biofilm, may pick up Borrelia biofilm. The Arcoda is definitely good for Babesia, But when it comes to Borrelia and Babesia and even Bartonella, the two of those alone is not the strongest treatments, right? So for Arcoda, you're going to want to either couple it with azithromycin and possibly Mepron. That would be get your strongest Babesia treatment. And then the methylene blue, I would want to be combining it with a second agent to go after the Bartonella and Borrelia, and you might consider doing like a fluconazole on that, just because there's some good activity against Borrelia that way, and the fluconazole probably picks up the cyst form of Borrelia as well too. Okay, those would be just some thoughts for you there. Chris, do you have any follow-up questions to that?
No, thank you very much.
All right.
Thanks very much for your help. It's disappointing because not you. The Miravorac is disappointing because like she's been sick. Our daughter's been sick 14 years, and we've tried so many things. And she does take a lot of, and she does take all the antibiotics in addition to that. But we were really hoping that it would be the miracle that it was.
I think Dr. Patterson way overstates the benefits of his thing. I have not seen it. And when I sit and talk with a lot of my colleagues, there are a few people that do report good benefits using his long COVID protocol applied to chronic tick-borne illness, which would be the Miravorac as well as the simvastatin. But I just haven't seen it. And on the whole, when I talk with a lot of my colleagues that are using it, they're not seeing good benefits on the Borrelia side of that at all.
Yeah, and it's very expensive. Okay, thank you. Bye-bye.
You're welcome. Let's see here. Let's see. Robin says, hi, Dr. Ross. Hello, Robin. Hello, Meg. Let's see. Greetings. At what point do we consider Lyme and associated co-infections cured, or at least in remission? Do the co-infections of Borrelia all go away at the same time? Is there a pattern or cycle? Yeah. It's a good question. I mean, the problem with any of the chronic tick-borne infections is that we do not have testing that tells us we're done. Now, let me just couch that because I know you'll see that some of my colleagues are doing ELISpot testing, which is an ELISpot is a test that measures whether your T white blood cells have tried to go after these infections recently. Okay. And a T white blood cell, when your body makes it, will circulate in your blood for about 2 months, and then they get cleaned out. So when we do an ELISpot test, what we do is we take your white blood cells, and then in the test tube we expose those T white blood cells to proteins from Borrelia if we're doing a Borrelia test, or to Bartonella if we're doing a Bartonella test, or to Babesia if we're doing a Babesia test. And then we see if your T cells release cytokines. And if they do, that means that they have seen those germs. And because they only live for 2 months, that means somewhere in the last 2 months they've seen it. Okay. So a positive ELISpot test means, yeah, the germ probably still is in you. Okay. But a negative test doesn't mean it's necessarily not there. And the reason it doesn't necessarily mean it's not there is the test has about an 85% sensitivity, meaning it'll find it if it's there about 85% of the time, but it'll miss it 15% of the time. In addition, and one of the reasons it may not always see it when it's there is that these germs sequester or hide themselves away where the immune system can't see it. So they don't live readily in the blood. The Bartonella, for instance, lives in the cells that line your blood vessels and in your connective tissue, fibrous tissues within the body. Lyme likes to hide away in tissues far away from bloodstream. So it just could be that the test on an ELISpot is negative, mainly because the germ is hiding and the immune system can't see it. Okay, so I just want to address that because I know there's a number of my colleagues out there that want to do ELISpot testing to see where a person is in treatment and then use it as some evidence if it's negative, the germ is gone. There's been no validation of that method, and there's many reasons to believe why it is not accurate. Okay, so I just want to let you know that. Okay. The other thing that some of my colleagues will do is they'll repeat your IGenex immunoblot testing, and if you have less reactivity, meaning the immunoblot is a way of measuring, do you have antibodies that are attacking the germ? If it is less reactive, meaning they interpret that as meaning you're not making as many antibodies, therefore the body is getting it under control. That has never been validated either, okay? And your body could suddenly decide not to make as many antibodies because the germ is growing in excess and actually suppressing the immune system so it can't make as many antibodies. And I could make that same argument even with the ELISpot. And ELISpot could be negative because there's so much immune suppression from the germs partying on that they're not going to have a positive test too. Okay, so I just want to dispel this idea that some of my colleagues have of retesting to see that you're done or where you are. It's not valid. And there's just no validity to that at all. All right. So what you're left looking at then is what's happening with you clinically. And so in general, there's 2 times that I stop treatment with my clients. One is if they get 100% well, and they've been 100% well for at least 2 months, then I will consider stopping. And the reason I wait 2 months, I found if I didn't wait at least 2 months, I had too many people that looked like that relapsed pretty quickly. So I think that you've got to keep treating an additional 2 months beyond symptoms being completely gone, just to make sure you get rid of everything. Okay. All right. And then the other situation I'll do is I will treat until somebody, if they've been getting better and we have gotten them on a good path of getting better, and then they plateau, and I try all kinds of things to get their treatment moving forward, and they still are at a plateau after about 4 months of trying all kinds of different things, I might consider a trial of stopping the antimicrobials as well too, and just see how they do. If it is too soon, they may start to relapse again. But in general, I have found if you've plateaued and I get in there and I try different herbal or prescription antibiotics, or I try to adjust the many different things. I mean, there's all kinds of things you can try to adjust. And even after doing a number of interventions, and after 4 months, no one's really getting a lot better, that's the time I'll consider stopping as well, too. Okay. Lisa, did that answer your question for you?
Thank you.
Oh, I'm sorry, Meg. I'm sorry, it was Meg. Lisa, yours is next. Yeah, Meg, did that get it for you there?
It did. Thank you.
Okay. Did anyone have a follow-up question to what Meg and I were just talking about? All right. Lisa, it's your turn next here. Let's see what we got. Let's see. I was recently clinically diagnosed with chronic Lyme after a lifetime of unexplained illnesses and previous CFS fibromyalgia. Diagnosis was stage 4 endometriosis. I also tested positive for staph infection by my dermatologist after having hundreds of blisters and open wounds on my limbs and scalp since October 24. When I began taking the Buhner protocol Lyme herbs, I was prescribed 100 milligrams of Doxy 2 times daily for the past month, and I stopped due to vomiting. However, just a few days after stopping, more wounds broke out and my upper GI became very painful. I have been taking probiotics 4 times daily, and my naturopath is working on helping to heal my leaky gut. She says to continue the Doxy along with the probiotics. I have almost all the symptoms of 3Bs. What are your suggestions for continuing antibiotics and for how long? The dermatologist prescribed it for 4 months. I'm continuing the Lyme herbs for the co-infections. Okay, hold on. Let me just look back here for a minute. So CFS, fibromyalgia, endometriosis. So how were you diagnosed with chronic Lyme? Was there any testing that was done that helped you get to that conclusion at all or not?
My naturopath suggested I take the 39-point questionnaire, and that's how it was clinically diagnosed. I haven't had any blood work done, and the tick bite was in 1974, so it was kind of like, I don't know if it would be helpful at this point.
Okay. So just a couple thoughts about that. Okay. So the problem is so when we look at how do you diagnose Lyme, we look at what's your risk of getting it, and a tick bite's a risk. Okay. What part of the world are you in? What part of the country are you in?
I'm in Hawaii. The tick bite was in Colorado when I was 6 years
So
old.
it's a moderate risk. I mean, it's not like the tick bite would have a higher risk if it was in New Jersey where 95% of ticks carry Lyme. I don't think we really know. I haven't seen any studies that tell me what percent of ticks carry it in Colorado, but there's some percentage. Okay, so I'll give you a risk there. All right,
And
so
the tick was lodged in my spine for 5 days. A doctor
yeah,
had to dig it out. So I've been sick ever since then.
and you were okay. So you got sick pretty close to or right after getting it. So okay, so you've got risk of exposure, you got sick after a tick bite. You look at what do the symptoms tell us? And the trouble is chronic fatigue, fibromyalgia, toxic mold, too many yeast living in your intestines, all produce too many cytokines, so they look the same, right? The questionnaire that you took, the Horowitz questionnaire, is heavily weighted towards your symptoms. And even though it is useful at saying, yeah, you got enough symptoms and risk of exposure to Lyme, you probably got it, it doesn't firmly diagnose it, but it gives you a good chance, okay? And then we look at do you have any physical exam findings? And trouble is there's nothing that's really specific for Lyme. And then we look at do we get any proof of it laboratory wise? And we haven't done the laboratory, okay? However, in your situation with the clear history that you got sick pretty much related to a tick bite, I would call this a tick-borne illness. All right. All right. So just to be thorough there, okay? And then so when I see people that have skin that breaks out a lot, one thing that I know um, from treating chronic tick-borne infections is that if you have too many yeast growing in your intestines, it leads to skin problems. And sometimes that can be pimples and acne, and some people it can be rashes and all kinds of things that happen. Now, your doctor they did a swab of these, and that's how they found it with staph then, basically. Okay.
Yes,
Did
yes.
they offer an alternative antibiotic to the Doxy for the staph at all or not?
No, I'm kind of in a situation, there's no LLMDs here in Hawaii, and so
Yeah.
I'm just pretty much depending on my naturopath, and my primary care doctor has already told me she refuses to prescribe anything for Lyme because she's
Yeah.
had bad past experiences. So I'm kind of just depending on the dermatologist and the naturopath to help me out here.
Okay. So what happened? So I can read back through here, but just tell me what happened on the 100 milligrams of Doxy to your skin? Did that get any better at all or not?
Yes, it got much better. The wounds stopped breaking out for about a month, and then
Okay.
I started having some side effects where I was throwing up for about 4 hours, and then I had a few new wounds break out after a month, and so I decided, oh, maybe I should just stop for and see what happens, about a week. And then not even a week, I started having a lot of upper GI pain again.
Okay.
It went away with the doxycycline. I'd had the upper GI pain since about October of last year. And
Okay.
then so I started the doxycycline about 2 days ago again, and the upper GI pain went away. So I thought, okay, it must be doing some good. So
Yeah.
I'm just asking about how long do you think I should stay on this doxycycline?
I will answer that. Just one other quick question. So, had your naturopath put you on anything to protect your stomach when you're on doxycycline? And by that, I literally mean the stomach, not the intestines, but the stomach. Did she put you on something this time around then?
Yes, well, I'm taking the probiotics, and then she also put me on the Thorn upper GI relief as well as SBA Protect.
Okay.
So I'm taking those two things with meals every day.
Do they happen to have licorice in it at all and maybe some aloe in it
Yes,
too then? Okay, okay,
yes,
good.
the
Just want
Thorn
to make
does.
sure that that part didn't get forgotten because obviously it was upsetting your stomach. It was irritating your stomach lining before, which is why you had to stop. So, there is, so in terms of chronic tick-borne infections and how long do you use doxycycline for, right? So in your situation, it's kind of altered because you're using it for your skin too. And you're using it for a chronic staph infection of your skin. Um, when it comes to treating chronic Lyme, the Borrelia itself sometimes can take 1 to 2 years of using herbal and or prescription antibiotics. Now, I would never leave somebody on doxycycline continuously over that whole 1.5 to 2 years if that's what's needed. But I will use it for up to 6 months at a time. I have done that as long as somebody can tolerate it, okay? Your skin, I would think within 2 to 4 months, the skin should be resolved on that doxy, all right? If you happen to have Bartonella Bartonella in 85% of people is something we can pretty much get rid of in 6 months, but Doxy would need to be used that whole time. And Doxy, although it can be helpful in a Babesia treatment if you happen to have that, and again, we're usually going to use it for that for about 4 to 5 months. So I think you could be on the Doxy as part of your treatment anywhere from 4 to 6 months, and I wouldn't be concerned about it as long as that your stomach, that what your naturopath is doing to help support your stomach lining can tolerate it, basically, all right? Is she talk when she says tick-borne infections, has she helped you figure out which ones at all by symptoms at all or not?
No, she's not. She said she's not very Lyme literate, but she is
Okay.
helping with my leaky gut. She said that if we get your gut to be stable, maybe it will help the co-infections. And in the meantime, I'm taking the herbs that you have and along with Booner's protocol.
Yeah.
I was read a couple of his books.
Okay. So just quick question. Any night sweats at all?
I did have it before I started taking the doxycycline.
Okay. And
I don't
then
have it anymore.
any air hunger, feeling like you can't get enough air from time to time?
I did have that a couple months ago. That's kind of gone away for the most part, but yeah, I did have that at one point.
Okay. And then any difficulty with thinking at all?
Yes, Karen, yes, definitely. The last several years, especially.
Is the thinking a lot worse, the decline in thinking a lot worse than the decline in your energy levels, or are they about the same?
Um, I've always kind of had not too much energy, so I don't really know how to quantify that, but the decline in my thinking was definitely apparent just because it was got so cloudy the last couple of years.
Okay. So if you were on the if you got your tick bite out in New Jersey, we know from East Coast studies that 75% of ticks that carry Borrelia will carry at least one other infection, and 50 to 60% will carry at least two other infections. Meaning, if you get your tick bite or you get your tick-borne infections from the East Coast, there's a very high probability you picked up Bartonella, Borrelia, and Babesia. There just is a high probability, okay? As you come across the country, that gets to be less. But again, we don't have the tick studies in Colorado to tell me. All right. My experience that I've had treating a limited number of people from Colorado is they tend to have Borrelia. They tend to have Bartonella. I haven't seen as much Babesia, but it's not out of the picture that you could have that. All right. I don't have time to go through all the symptoms to see which ones you might have, but if you're trying to cover for all three, the herbal combination that I like best is a combination of Cryptolepis, Japanese knotweed, and cinnamon clove oregano.
Yes,
Right.
I'm taking all those.
Yeah.
Yep.
If you're doing those three, you have got good coverage for all three infections. Okay. And if you are doing all three of those, you do not need to be on the Buhner antibiotics because Buhner is going to wind up doing cat's claw, Psittacuta hootenia. You don't need those. Buhner
Okay.
was not aware. Buhner died a year and a half, 2 years ago now. And he was not aware of all the research about persisters, nor was he aware of this newer research we have that now tells us what all these different herbs can hit. He was not aware of that. Okay. So I would consider you don't need to, even though they're herbal antibiotics, I try to warn people not to overhit themselves with too many antibiotics. Go with as limited number as you can. So I would probably look at my suggestion would be a crypto, knotweed, and the cinnamon clove oregano, and not do necessarily the other herbal antibiotic parts of Buhner. Buhner's got some other stuff in there that he does as well too. Okay.
So no grapefruit seed
You don't need it. You don't, yeah,
Okay.
you don't need
I'll
to
stop
do it
that.
if you're on that, if you're on those three. Yeah.
And
Okay.
no wormwood. Wormwood was in there too.
I don't
No.
think you need it because the crypto is a really strong antibabesial, and the clove within the cinnamon clove oregano can pick up babesia as well too.
Okay. I
Okay.
appreciate it. Thank you so much, Dr. Ross. Your
Yeah.
website has just been amazing to work with.
You're welcome. Thank you. Oh, the other reason I'm saying to kind of back off on some of these herbal antibiotics that you don't need is they're also upsetting your stomach.
Okay.
Okay,
That,
that was the
no.
key to what I'm trying to do. I'm trying to lighten the load of things that might upset your stomach there a little bit. Okay.
Okay.
Yeah.
I appreciate it. Thank you.
Yeah. Good luck to you, Lisa.
Aloha.
James, I see your hand up there.
Yeah, just to follow up on
Yeah.
Lisa's question, for Cryptolepis and Japanese knotweed, suppose the patient doesn't do well with the liquid forms and is looking for the pill form.
Yeah.
Is there a good cross-reference that's available to say how
Yeah.
many milligrams of pill would I need instead of milliliters of liquid?
Yeah. I wish I knew. I don't. I don't. And the reason is I had in the past used pills. I just don't find them as effective. The one thing that I can tell you on um, for knotweed, I believe if you were to get one of Buhner's books, Buhner does have his own. Just Google Buhner, go to Buhner Herbs on Amazon. You'll see he's written 3 books, one on Lyme, one on Bartonella, one on Babesia. Okay. And in there, if you look at he'll have recommended dosing on Japanese knotweed in a pill form. I respect him as an herbalist. Whatever he's recommending for a pill form strength on that. I believe he also does have a pill strength for the Cryptolepis. You might take a look at that as well too. He would not have done the oil, so I can't tell you those. And then the other thought too, in case you haven't tried this, sometimes what bothers people about the tinctures is the alcohol part. And you can steam off a large part of that alcohol by just boiling up some water and taking like 1 or 2 ounces of that boiled water, putting it in a glass, and then just literally dropping in how many of the drops you want to for the day into that, or for the dose into that. Let it cool down and drink it. The active parts of the herbs will still be good, but it will steam off a lot of that alcohol, and it's the alcohol that's sometimes the thing that people can't tolerate.
You can get the glycerite version too. From
The thing about you can there also you can find glycerites. The trouble is I don't find the glycerites to be as the extraction to be quite as strong. It doesn't. So what you're doing with both alcohol-based tinctures and glycerite-based tinctures is you're putting the herbs, the plant, into something to pull the active ingredients in, and I just don't find the glycerites to be quite as strong. Yeah, yeah, it's a good comment though, Eric. I appreciate that. Yeah. All right, let's move on here. Hello, Joe. Let's see. Hi, can you give me an opinion on dark field microscopy? I had a positive test for the 3Bs, but I don't know how accurate to treat it as. My main symptoms are Morgellons symptoms as opposed to Lyme symptoms, and it is possible to find a doctor who is trained. All right, so the trouble is with dark field microscopy, you don't have confirmation that what they're seeing under the microscope that looks like a Lyme spirochete is actually a Lyme spirochete. There's other spirochetes in our body, okay? There may even be spirochetes we cohabitate with that aren't a Lyme spirochete, for instance, okay? And I might make the same case for Bartonella, and I might make the same case for Babesia. So I don't find dark field microscopy to be reliable. I don't think it can be repeatable. And meaning if you probably put 2 people that were trained in it under the same slide, they might see different things. And what they're seeing, although it may look like a spirochete, who knows what spirochete it is? It may not even be a Borrelia spirochete. Okay, so I don't put validity into that. The other comment that I would make about Morgellons is there's generally, we think that Morgellons is a component of chronic tick-borne infections. Whether it's caused by the tick-borne infections or it's due to immune suppression and a skin manifestation from having tick-borne infections, who knows? But in my opinion, I think it's a skin manifestation of Borrelia. I know that Ginger Savely, who is a nurse practitioner that has worked extensively in this space and is an expert in Morgellons, it is her opinion that it's actually due to any 3 of the 3Bs, that it's a manifestation of any of the 3Bs. In her experience, treating the 3Bs will often take care of it. In my experience, I treat whatever the 3Bs are that I think are there based upon clinical symptoms and testing. So if it looks like it's Bartonella and Babesia, I might just treat those, and often the Morgellons will get better. Or meaning I use antibiotics to treat them, or herbal antibiotics to treat them. And um, or if I think that there's just Borrelia there and I go after Borrelia and I manage that with herbal antibiotics or prescription antibiotics, getting rid of the Borrelia often is what gets rid of the Morgellons as well too. Okay, so I just want you to know that. And then, you know, there are a lot of doctors out there that are aware of my work. That doesn't mean all of them use my work. And in fact, a lot of them, I know from when I go to ILADS meetings, everyone circles me and wants my opinion on because they're using my stuff. That's how I know. But, you know, I'm not sure. I don't know out there who's using it. The only person I know that works in a similar way and is very much aware of my protocols is a physician in Connecticut named Jennifer Letitia. Um, Beyond that, I'm not aware specifically who would be a Marty Ross MD certified provider, if you will, or somebody that works in the same fashion.
Do I need to know how to spell her name in order to Google her?
It's Letitia. It's Jennifer, and then Letitia. It's Letitia. Letitia. I'm sorry. Letitia.
Got it. Yeah. Thank you.
All right. Yeah. Good luck.
Thanks.
All right. Did anyone else have a comment there about what I was talking with Joe about?
I mean, I have some more, another question or anything, if that would be possible.
Yeah, go ahead.
Okay, great. So when I say I've got Morgellons symptoms,
Yeah.
I think it's unusual because I've got the itching and the crawling feeling, but I haven't ever had threads coming out of me or the grotty bits that people have coming from them.
Okay. Do you have any skin breakdown at all or not?
I did initially when I first got it about just over a year ago. I had a terrible rash on my back.
Okay.
But
Is that still there now or not?
no, I used the bee venom treatment from
Okay.
from Megan, who's known in that kind of area of people's
Yeah.
illnesses, and that cleared the rash up beautifully.
Okay.
But the itching, it's like there's something living under my skin. It's classic in
Okay.
that kind of feeling, you know.
So a couple thoughts. So a number of comments actually.
Yeah.
So bee venom therapy, there's a chemical in bee venom that does a couple things. One is it can be antimicrobial. As to whether it's the greatest antimicrobial, I don't know. I mean, I've had people that have tried bee venom therapy that have had mixed results. I do have a few people that it was the thing that changed their life. Okay. So I mean, be honest with that. Okay. But one of the thing that this chemical, I think it's called cacactin. I'm blanking on the name of it, but the chemical also is anti-inflammatory. It helps lower the cytokines that give you a lot of the symptoms. All right. So I mean, I understand you got better on it. I'm not sure you got better on it because it
I
killed
didn't get
some.
better. Then the rash went, which
Okay. Well, let me put it
got
this.
much better, but I'm still having that, particularly in the evenings. I'm on some of your herbal, and I'm on the cryptolepis and stuff like that. That's helped a lot, but I'm concerned to get completely rid of it. So I still have that crawling and itching feeling
Right.
a
So
lot.
let me rephrase that. You had a skin improvement, which I took as part improvement, not that you're all well. Don't get me wrong. Okay. All right.
Yes.
So the other thing then, you know, Morgellons, everyone is a skin situation, and usually you're going to get a lot of itching and you're going to break down the skin. And it's very common that these breakdowns in the skin have black fibers or other colored fibers coming out of them. The fibers are not parasites. When they've been looked at under the microscope, we think that they're keratin, which is a protein in the skin, keratin accumulations. All right. But the other, and then sometimes it'll have a crawling or itching sensation associated with it too. But technically, when you're going to diagnose it, you're going to think of skin breakdown as part of it too. All right. I'm just saying technically. Okay. Now, on the other hand, be aware that if you've got something irritating your nervous system, neurologic manifestations, peripheral nerves that are injured, and being infected or affected by Bartonella and or Borrelia could also give you itching and crawling sensations, right? So itching and crawling sensations tend to be a neurologic neuropathy symptom just like numbness sometimes is a neuropathy symptom, and sometimes burning sensations are neuropathy symptoms. Okay.
Yeah.
So it may be that the reason your skin is doing better, you've knocked whatever germs are causing that skin problem down, but you still have ongoing chronic infection because these infections, as you know from reading my stuff and participating in these webinars, they take a long time to get under control sometimes, right? So it just may be that the neuropathy part of this, the itching, crawling sensations, may take longer to go away.
Yeah.
All right. Any other question there or comment?
I think Methylene was the peptide you were looking for with the bee venom.
It's Melian.
Melittin or Melittin.
Melatonin. Melatonin. Yeah, that's one.
Thank you. I knew it started with an M, but thank you. I appreciate that. All right. All right. Let's move on here. So,
Thank you, by the way.
yeah, Joe, did that cover everything for you then?
Not at all, but I don't want to take more than my fair share of time. I mean, but it was very useful to hear it. And if there's, I want to just not take too much time, but if I can come back another time and ask the next lot of questions, that would be great.
Absolutely. Thank you.
Thanks.
So Elizabeth, let's see. Bart's symptom of collagen breakdown has progressed to skin on forearms, hands, feet, now thin and somewhat transparent. Hypersensitive to pressure, sharp edges, including skin sloughing off or skin tear with a impact. Tissue in feet shrunk, sore tongue. I started marine collagen, 11 grams QD 6 weeks ago with brief improvement and discomfort, and just ordered the Thorn collagen on your list. Shall I take both? Started BPC 157, which should help. Is there anything else I should take about collagen breakdown? I think you could do both the collagens. So rebuilding collagen could help. The BPC 157 is a peptide that is made in the stomach lining, that was made in the stomach actually to help keep the intestines working right. But we know that it's great at doing tissue repair and joint, muscle, and tendon injuries, even nerves. And so presumably it can help rebuild connective tissue as well too. So I think you're doing what I would suggest on that actually. And then obviously continue working on your underlying infection that's causing the problem too. Yeah. Elizabeth, I hit your microphone on.
Okay. Yeah, there's more down below. One more paragraph about infection. I had to do it in pieces.
Oh, you wrote it up. There's a second part to your question. Okay, got it here.
Yeah.
Let's see. And I take an array of supplements, many usual suspects. First 6 months, Bart per LMD had been taking Tick-immune 2 to 3 times a day, post mild Bart symptoms, which includes many Bart herbs as well as binders and more. And on methylene blue, 50 milligrams AM and 10 milligrams PM, which helps energy. Have been titrating up Cryptolepis. Revisited LMD early May with increased symptoms, collagen, bloated vessels, increased brain. She treated azithromycin BID and Bartonella. I suggested adding more treatment per norm. Replied, try it for a month and see if you feel better. I didn't say that's not the goal. I need treatment. She didn't want to up the methylene blue to 50 milligrams BID, but I could. I did record our recommendation or your recommendation last week, and here for crypto, Japanese knotweed, cinnamon clove oregano, and fluconazole azithromycin. That's 3 of 2 antibiotics. Perhaps LD would add fluconazole per your recommendation. If not, I need 2 more treatment herbs. A question, starting biodisrupt. Okay, so to really strengthen that treatment, I like using, from a prescription standpoint, the combination of methylene blue, 25 milligrams twice a day, up to 50 milligrams twice a day, I think is better. Okay. Plus fluconazole. I love that 2 herb combination or prescription combination. But then azithromycin may or may not help that. So it'd be a triple antibiotic if she would go for that for you. Okay. If she will not do that, let's see, your herbs right now again are cinnamon clove, crypto, and the Japanese knotweed. Is that correct?
No, I was just saying that's what you had mentioned. You've been mentioning, so I can add those.
Yes, you could. You could actually, if you're still on the methylene blue, and the azithromycin. If you
Yes.
wanted to beef that up a bit more, you could do the crypto Japanese knotweed and cinnamon clove oregano on top of that. Yeah.
Okay. And then ask for the fluconazole. Okay.
I think given the amount of tissue breakdown you have, I would probably be pretty aggressive about going after your germ load.
My feet are disappearing and I'm a dancer.
Yeah. Yeah. I got it.
Great.
I'm sorry to hear that too. Yeah.
Yeah. Okay. Thank you.
Yeah. Good luck.
Thanks.
All right, everyone, I just want to say a few things about Bartonella. So, and you may have all heard me say this before, but the key thing about Bartonella, oh, and maybe there, I have another idea for you here too, Elizabeth. Um, so Elizabeth, the one thing you may want to also consider adding to your treatment
Yes.
is take a look. There's a product that is an extract of something called rhamnin sulfate, which comes from a seaweed called I'm going to give you a product name in a minute, but rhamnin sulfate is a extract that comes from a seaweed called Monostrum nitidum, and it's sold as a product called Arterosil, Arterosil.
I have it written down. You always recommend it. Yes.
Yeah. Okay. Now the reason I like, so when you're dealing with Bartonella, there's a few things to consider. Okay, we got to consider going after growing and persisters. And a methylene blue fluconazole is great against growing and persisters. A cinnamon clove oregano, Japanese knotweed crypto, good against growing and persisters. Okay, so you got to consider growing and persisters. Number two, you've got to consider getting rid of what is known as, except I wouldn't do this in your situation, but there's something called fibrin nest, which is Bartonella can wrap itself around blood clotting protein called fibrin, and lumbar kinase can help break up that fibrin. The trouble is, I'm not sure if the lumbar kinase is going to do anything against your proteins in your connective tissue, and you're already losing your connective tissue, so I probably would not do that. Okay, all right.
Okay, because I had started it because you're always recommending it.
Yeah,
yeah.
I'm not sure. You may want to see by adding it, do you get worse with your connective tissue or not? I don't know whether it goes after tissue. Protein and connective tissue at all or not. Okay. All right.
How about serapeptase? Can I take that instead?
That again, I don't know. With all the connective tissue stuff, I'm kind of concerned about putting you on enzymes that break proteins down. Okay. All right. Number three, you want to make sure you're doing things against biofilm. So Bartonella can grow slime layers over the top of it. And the biodisrupt is one way to do that. Methylene blue breaks down biofilms as well too. Okay.
I just ordered Biodisrupt and I am on methylene blue and I wonder if I should go up to 50 BID.
The one thing about Biodisrupt that might be a concern is it has proteolytic enzymes in it too.
Oh. So
I might
maybe
hold
not
off on that. That methylene blue may be what you're doing to break up your biofilm for right now.
Okay. And I think I want to go up to 50 BID.
Okay, yeah, because I just want to let you know it breaks up biofilm too. Okay, all right.
Okay.
All right, then the last component to think of with Bartonella. All right, so I said growing and persister, deal with biofilm, deal with fibrin nest if you can. Your situation's a little tricky because you already got connective tissue destruction. Okay, and then finally, Bartonella may lead to injury to what is known as the endothelial glycocalyx, which is a lining on the inside of your blood vessels. Specifically, Bartonella infects the cells that make up your blood vessel linings. Those are called endothelial cells. And endothelial cells are covered by a matrix called the endothelial glycocalyx that literally has kind of like hair fibers that stick up into your bloodstream. And when those hair fibers get caught in blood motion, they bend and it triggers nitric oxide to be made by the endothelial glycocalyx and the endothelium. That nitric oxide leads to blood vessel dilation that makes it so your antibiotics get further down the bloodstream into the deep tissues. Okay.
That's not good.
So it'd be good if you could repair endothelial glycocalyx and see if you get some benefit. And that's what Arterosil is designed to do. Okay. And so that, and where we got good track record is in COVID. We've got some good track record in people with cardiovascular disease. There's no studies in Bartonella. And there's no proof that Bartonella wipe does anything to the endothelial like a calyx, but I have seen good benefit adding it into treatments. Okay.
Well, my blood vessels are bloated.
Yeah.
Yeah. And you said Arterosil is okay.
Yes.
Okay.
You can do that. Yeah. I would start at two pills twice a day to start for a month. And then I have people decrease it to 1 pill twice a day after that.
Thank you so much.
Good luck to you.
Thank you.
Yeah. All right, let's see here. Hello, David. Let's see. I have MCAS or MCAS, not IAS, MCAS, MCAS. I take, which is mast cell activation syndrome. Everyone, I take low dose naltrexone and ketotifen at bedtime. Can I also use KPV together with low dose naltrexone and ketotifen? Yes, you can. All right. So everyone, mast cell activation is due to your mast cells, which are your allergy cells, your histamine producers in the body, becoming overreactive. And we know that they can become overreactive because germs and toxins can turn them on. So instead of just releasing their histamines when a pollen lands on them or your dog dander lands on them, they just become these histamine releasing factors and you become sensitive to about everything. You react to everything, okay? So what ketotifen does is two things. It stabilizes the mast cells so they tend not to release as much histamine. Secondly, it is an antihistamine. So after the histamines get released, it can block the histamine receptors, all right? Low-dose naltrexone is a narcotic blocker, and our body has a natural set of narcotic receptors called endorphin receptors. And if you block endorphin receptors for short periods of time, it modulates the immune system and seems to help with mast cell activation, right? And then finally, KPV is a peptide that is got benefit at stabilizing mast cells as well, all right? So the beauty of doing a KPV LDN ketotifen is you are basically working from 3 different angles to stabilize those mast cells. And I see no problem doing them together. I have no problem with that at all. David, do you have any follow-up question to that?
No, I don't. Thanks, Dr. Ross. That was a big help. You talked about I think the last Zoom session, and I had to go sign for a package at the door, and I missed the rest of your comments. So you filled in the blanks today. Thank you a lot.
Okay, you're welcome. Good luck. And everyone, the way you do KPV, you can either get it as a spray or you can get it as capsules, and it's 1 spray twice a day or 1 capsule twice a day. The company that I carry at my store that has it is Integrated Peptides, and they seem to have good products. So that would be something to consider as well too. Okay. All right. Does anyone else have a follow-up question for what David and I were talking about? All right. Hello, Mary. Let's see. I read that you should not take ATP 360 with multivitamins. What is your opinion on this? How long until you see results? I don't know if that's such a hard, fast rule, but let me try to say that. So the thing about ATP 360 is ATP 360, everyone, is a product made by Research Nutritionals. And its main components are a proprietary phospholipid mix. Phospholipids are the fats that make up your cell membranes and your mitochondria membranes. And their mix has a number of different phospholipids in it. And it's designed in a way to repair your cell membranes and repair the membranes of your mitochondria. Okay, right. The other major components of ATP 360 has got some coenzyme Q10 in it, and that helps with some of the ATP production. ATP is the energy molecule made in your mitochondria. It's also got something called PQQ in it, pyroquinylene quinone, which is useful at helping your body make more mitochondria and make the existing mitochondria bigger. So you get more energy or ATP production by it. And then finally, the last major component of the ATP 360 is it's got a host of minerals and vitamins as part of it too. All right. So what the issue may be, Mary, is that they're saying we already getting all these vitamins in the ATP 360. Don't take another source of vitamins. All right. On the one hand, you can make the, but if you were to hold up one bottle, if you were to look at the ingredients list, you're going to find it doesn't equal fully a multivitamin. What's in ATP 360 does not fully equal what's in a multivitamin. Anything that is in your multi that's in ATP 360, and it's going to be a few things, it's not a lot. If at most you're going to be peeing out what you don't need, but you're still with the multi going to be getting all those other nutrients that might give you benefit as well too. All right, so those would be my thoughts on that.
All right, thank you.
Yeah, you're welcome. One thing that's interesting about the ATP 360, everyone, Research Nutritionals has done some studies trying to see if their product is useful. It's a small study. They did a study looking, I think it was over 2 months, looking at 12 people that use their product. But in that study, I think average energy improvements were, I believe, almost 48%. People's thinking went up about 50%. So improved thinking, improved energy. There was decreased inflammation and improved sleep. Those are the big findings from their study. So yeah.
So, and how long did it take? You think like a month or 6 months?
About 2 months to start seeing improvements, and then it can take up to 6 months to lock that all in to get your maximum improvements. Yeah. Okay.
All right. Okay. Thank you.
Yeah. Good luck to you, Mary.
Thank you, Dr. Ross.
You're welcome. Hello, Bill. Good to see you there again.
Hello, Dr. Ross.
Let's see here. Hello, Dr. Ross. I have been, I should call you Dr. Hazen then too.
Whatever.
Everyone, Bill's a veterinarian. So yeah, so that's why I'm calling you doctor at the same time. Let's see. Hello, Dr. Ross. I've been treating Borrelia Bartonella for the last 25 years with some improvements, but never totally asymptomatic. I was always testing it for Babesia until recently when I got a positive fish test with T Labs. So the last 6 months, we focused on Babesia, taking clarithromycin, primaquine, methylene blue, cinnamon, clove, oregano, allium, ivermectin, and Arterosil. By March, I became asymptomatic and I felt the best ever and thought I was cured. Good, good. Let's see, I had to stop the medications as I was working out of country and had run out of the meds. And a week after stopping, I started getting symptomatic again, i.e. heart arrhythmias, elevated blood pressure, elevated intraocular pressure, neuropathy in my feet, anxiety, and brain fog. I am home now and restarted the same protocol and all symptoms are gone again except the neuropathy, burning sensation in my feet. Any thoughts on how long I should stay on these meds to get more of a cure? Would you add anything? So how long?
I think you answered that at the beginning there. You said 2 months after your symptoms are.
Yeah. And in yours, so I want to just round that out a little bit though. So you know the do you happen, so with T Labs, was it a Babesia oticoli or just the Babesia genus that they did?
Babesia genus.
Okay. Did they do an oticoli to see if it was there too and it came back negative, or
No,
just the genus?
No, haven't done oticoli yet. No.
Okay. So everyone, Babesia, the predominant strains that we used to think of being Babesia is something called Babesia microti and something called Babesia decani. And then more recently, Dr. Harry Lindner, many of you may be aware of his name, has been advocating that maybe we should be looking at something different, which is called Babesia oticoli. Okay. So Babesia oticoli is really predominant in deer populations. And if we look, and has not been well tested for in the past. There may be cross-reactivity in your immune system and how we test for Babesia decani. So it's possibly a lot of that Babesia decani out there has been Babesia oticoli. All right. Now, Babesia oticoli is a bit different than Babesia microti and decani in that it has the ability to sequester itself and hide itself within fibrin. So these fibrin nests, okay? And because of that, Lindner proposes, and I'm not sure if he's right, but I'm just going to talk about his theory. he thinks that if it is O. coli that people have, that we may never get rid of it. The best we may do is control it, and it may be an issue of periodically starting and stopping your antimicrobials as symptoms come and go. Okay. So, Bill, the reason, and what he also proposes is that it can mimic what Bartonella looks like with all the cognitive dysfunction, and it can mimic what Borrelia looks like with all of the fatigue as well too. So I just want to throw that. I don't know if he's fully right, but he may have something to it. Okay. Now, if you told me your O. coli was positive, what I would have definitely said is maybe maybe you treat for 4 months, and I would probably say that if you got worse this quickly, you might actually go for 4 months of feeling well before you stop this next time. Okay. But if you relapse again, what I would be inclined to do after that is just leave you on something that's going after O. coli. And you might even just go with one agent. So you might just do it with primaquine by itself and not all the other things that you're doing, for instance. Okay. And then the other thing, you may have it in here. I can't remember. Have you tried lumbar kinase with this treatment at all or not?
Yeah, I forgot to. I am taking lumbar kinase and biodisrupt as well.
Okay. Yeah, so the biodisrupt may or may not help the fibrin nest. The lumbar kinase does. I mean, it's your most potent fibrin buster, basically. So yeah, so you're doing a good job. I mean, a problem in Canada is that you can't get your hands on the
Tafenoquine.
and so the tafenoquine, which is in the same family as your primaquine, is probably stronger. But this is good. I know you're on ivermectin. If I were working with you, I might even consider, instead of doing the ivermectin, I might use atovaquone instead. Lindner's approach and I'm saying this because maybe this is O. coli. I don't know if it is or not. Okay, but so Lindner likes doing a combination of azithromycin, atovaquone, and the tafenoquine at the same time. I have found good benefits with primaquine, using it with atovaquone before. I've had good benefits that way. I've also had good benefits with the tafenoquine with the atovaquone as well too. So you might, because this came back so quickly, you might tweak the treatment just a little bit and pull that ivermectin out and go with the atovaquone instead, and 5 milliliters twice a day on that.
Sounds like a plan. Thanks so much.
Yeah, good luck to you. So
Okay.
everyone that's wondering what the heck this foreign language is I was just talking about, take a look at my article called Kills Babesia, a brief guide. I'll just show it to you real quick. And I talk about all of these different things in there. Let's see here. All right, so I think you all know it, but I've moved both my education site and my supplement store together. Okay, so under this section called Lymology Guides, if you were to look here, you can find infection plans. And these are the infection plans. And then in here is my article on the ultimate Bartonella management guide is there. Also in here, boy, I thought I had rearranged this. Oh, I know what happened. Darn it. So anyhow, this in here is my Babesia guide. It's supposed to be at the top and it's not, and it tells me I've got to go back and redo this again. Here's my Babesia guide. Sorry about this, guys. I had this set up so actually the best articles are at the top, the most frequently used. And we had right after we launched, somebody found we had malicious malware that was injected into the site and screwed everything up. So they had to go back to an older version. And it looks like all the work I did that put the top priority articles at the top now has been outdone. So it looks like I got to go back and fix that. Anyhow, there you go. Let's see here. All right, Bill. Good luck to you. Does anyone have a follow-up question for what Bill and I were talking about there?
Real quick, do you have any concerns with oxygen delivery with tafenoquine?
And I'm not sure there would be a concern. I haven't seen any concerns. Are you here reading something at all or not?
I've heard something about a word I can't pronounce with methylglima.
Oh, methemoglobinemia.
Yeah.
Yeah, so rarely it can happen. So what happens in methemoglobinemia is so there the one thing that you might want to look for before doing a tafenoquine, even a primaquine, although I've never had trouble with it, is to check something called a G6PD level. That's one problem, okay? And if you have low G6PD, which is separate than methemoglobinemia, but if you have low G6PD levels, then you're more inclined to have breakage of your red blood cells or hemolysis, which is a separate issue. There's another condition called methemoglobinemia in people that are predisposed, where your hemoglobin under stressful situations will not let go of your oxygen. So your tissues become oxygen starved. And so if you're on a tafenoquine and you start having some shortage of breathing, you might want to get a blood count, just make sure you're not hemolyzing. But if you're not hemolyzing, you may have developed methemoglobinemia, and the treatment is to either back down on how much of the tafenoquine you're using, or to add in some methylene blue. And you can use low dose methylene blue to counter that.
Thank you.
Yeah, you're welcome. All right, let's see. Hello, Anthony. I see currently taking low dose dapsone, 25 to 50 milligrams per day, clarithromycin, 500 milligrams per day, hydroxychloroquine, methylene blue, leucovorin for the 3Bs. Was experienced severe stiffness, back, neck pain, costochondritis previous to this, and my doctor prescribed those medications to hopefully knock down the infections. We also was also supposed to take disulfiram and this as well, but I have not added this in yet. It has been 3 months so far and have only experienced some relief from the pain. Wondering if I should continue with this or move on to something else. I have tried BPC, TB4 frag peptides. They help a bit. Any advice would be appreciated. I always feel like I'm missing something with my protocols. Thanks so much. Okay, so you're doing 25 to 50 milligrams, clarithromycin, and hydroxychloroquine, and methylene blue and leucovorin. Okay, so this is you're doing one of Horowitz's dapsone protocols. Some people propose even doing higher doses on the dapsone. The trouble is dapsone, about 50% of people that take it at higher doses than what you're on can lead to muscle pain and fatigue. So what's hard for me to say here is your pain and stiffness now a side effect of being on the medication, or is it because it's just not working effectively at your infections? If your existing provider would work with you on this a little bit, they might consider even going up higher on the dapsone to see if you get improvement. But if you get worse, then it may mean that you've got a problem with side effect to the dapsone. Okay. In which case, and then disulfiram, I just want to let you know, most disulfiram for the most part has fallen out of favor. Most of us are not using it anymore. You've got a big risk on disulfiram of developing neuropathy. You've got that doesn't go away. I just want to let you know. And in the end, follow-up studies to the original studies that suggest we use disulfiram are not showing good benefit, actually. So many of us are staying away from it just because we don't think it has a good safety profile, nor do we see good long-term benefit from it. All right. So I'm not sure who you're working with, but your doctor may want to start by thinking about, if you're not advancing on this protocol, and if you have the 3Bs, you might consider working with that doctor on a Cryptolepis, Japanese knotweed, liposomal cinnamon clove oregano combination. By now, if this regimen was working for you, I would expect to start seeing some improvements.
Okay, thanks. Yeah, I was on that combo of herbs before, and then the body pain just got really, really bad, really stiff, and like in the ribs and lower back and everything. So we tried, entering a little bit of the dapsone. I remember I mentioned before, like try to get to at least 50 milligrams. When I get there, I don't feel great. I do have the side effects from it, so I back down from it.
It's a hard drug. Yeah.
Yeah, it's a tough one. And the clarithromycin, I think we're supposed to get to like 1,000 milligrams a day or something, but there was no way I could do that. It was just wrecking my stomach.
So do you have the 3Bs actually?
Yeah, so for about 8 years now, and did a lot of herbal protocol, and then the antibiotic stuff. I was on the desulfuron when it started becoming more mainstream, or when it started coming out. That did help quite a bit, but I did have some neuropathy, so I had to back down from it. So I was kind of cruising along the last couple of years with herbal protocol, but I felt like just the pain, like the body pain got really bad and the headaches, neck pain. So that's why I was working with my doctor to see if we have to hit it a little bit harder.
Yeah.
That's what I'm taking now. But
yeah, I think the only way to get this stronger would be to bump that dapsone, but I don't think you're going to tolerate it.
Yeah, I don't think so. Yeah. Okay.
I mean, and again, I just had a few minutes to talk with you here, so it's not the same as me sitting with you an hour and a half in my office and hearing
Sure.
your story. Okay, but some things to think about if you've already not done well on or not the crypto, knotweed, and liposomal cinnamon clove oregano didn't do anything for you, and this protocol does not seem to be helping either. What I would look at doing is even considering just a new way altogether. And one thing you might consider doing would be on the Bartonella side would be to stay on your methylene blue, but I would do 50 milligrams twice a day. I would look at going with fluconazole, 200 milligrams a day. And both the methylene blue, based on Hopkins research, is good at growing Persister Bartonella and breaks up biofilm Bartonella. And the fluconazole is in a family researched by Hopkins. The family, there's a drug member called clotrimazole that's in the family where fluconazole is. That showed good benefit in the lab. And in my experience, I love working with fluconazole. I've seen some really good improvements on it. Okay, so you could go Bartonella, growing Persister with the methylene blue, 50 milligrams twice a day, fluconazole twice a day. That treatment also is a fairly good Borrelia treatment. The fluconazole can go after cyst. The methylene blue goes after growing and Persister. You might stay on a clarithromycin with that so that you pick up spirochete a little bit better. Okay. And then from a Babesia standpoint, add in the Tafenoquine, which is kind of our strongest Babesia treatment these days. And you could take Tafenoquine, the clarithromycin Tafenoquine would be a good starter Babesia treatment. Anyhow, that might be one way to go ahead and do this. So it'd be a combination Tafenoquine, clarithromycin, methylene blue, and fluconazole might be a way of going a different approach that you probably haven't tried before.
Yeah, yeah, I haven't tried that, so that's great. Okay, thank you.
Yeah, good luck to you.
Thank you.
You're welcome. Hello, Deborah. Let's see. A year and 5 months ago, I was diagnosed with Lyme, Babesia, and perhaps Bartonella. I've had joint problems most of my life, and my LMD thinks I have had Lyme for years. A real possibility since I have been a camper and outdoors person most of my life. I had one hip replacement. Docs have suggested replacement for my knees for about 10 years now. A second hip replacement is recommended. I am trying PRP first. If I have Lyme-induced arthritis, are there other treatments or suggestions for how to go forward, since I also have issues with my shoulders? Boy, you're in a tough situation. So the problem with Borrelia is we think it can break down your cartilage, basically, which is then going to make it easier to get the osteoarthritis. There are two things you might consider if you're not doing these already to help with the joints. Would be number one is BPC 157 can help repair connective tissue and even cartilage injury. And that would be, I would do one pill twice a day on that. And then there's a company called Calroy Health Sciences that just released a new product. I don't have it in my store yet, but we'll be getting it. And it is called Cartigenix, I believe. And Cartigenix is a seaweed compound that has got some good laboratory data showing that it will help regrow cartilage. I need to get more information to you about that. I don't have it on hand right now because I need to read more of their product descriptions on it. But the at least the science I've looked at looks pretty promising. I would suspect within about a week or two, I will be putting it into the store and have description of that product up as well too. But that might be something for you to think about, Deborah.
That sounds incredibly positive if it would
Yeah.
regrow cartilage.
Yeah, it has got some data suggesting it regrows cartilage. So,
wow.
Yeah, we'll have to see. We'll have to see.
Is there a different approach to treating Lyme-induced arthritis or Lyme arthritis than regular osteoarthritis, or is it kind of the same thing?
It's the same thing. You still have to do stuff to support the cartilage in the joint. But you've got the added issue of you've got to get the infections down so they don't keep destroying your cartilage, basically.
Do you think PRP is a reasonable thing to try at this point? I still have some cartilage in my left hip.
Yeah, I think the only way that PRP makes any sense is if you've got some scaffolding of cartilage for the PRP to promote growth. So with PRP, platelet-rich plasma, everyone, when you take your own platelets out, you spin it down and re-inject them again. The platelets have what are known as growth factors as part of them. And those growth factors can turn on growth of tissues that are still there. That's what the problem is if you've got too much cartilage destruction, it doesn't have anything it can promote growth of, basically.
Well, so far, I've only lost one joint. I'm trying my best to keep the rest of them.
Yeah, I'm interested to see. Again, the Cardigenics just got released on the 25th.
That's
and
amazing.
It looks interesting to me. I mean, if at least the lab data will hold up in clinical trials or in people start using it, I think it'll be an interesting product. But yeah, look out for about a week or so. I'll probably have that up on the store.
Really? That's soon. Okay, great. Thank you so much.
You're welcome. All right. Take care, Deborah.
Thank you.
All right. Hello, Missy. Let's see. With gastritis, who couldn't take CCO oils to take liver kinase, but your info on it says not to take it if you have ulcer or bleeding conditions. Do people with gastritis tolerate? Oh, interesting. I think what the issue is the manufacturer on the liver kinase basically is worried that if you have a blood clotting disorder, that you would not want to take liver kinase. A blood clotting disorder is different than gastritis, okay? So blood clotting disorder would be like a person that doesn't make enough platelets, for instance, or has something called factor V Leiden disorder, something like that. But for the average person, liver kinase would not be a problem. Frankly, I haven't seen it irritate a gastritis either. So based on what you've just asked here, I don't see a problem with doing that. Missy, are you still there?
Thank you.
Okay. All right. Did that answer your question for you?
You're an angel.
Oh, thank you. I appreciate it. Good luck to you. Hello, David. Let's see. From a June 23rd lab core test, I got these results on an IgG Lyme blot. 41 and 39 both present abnormal. All others absent. What does present abnormal indicate? So present means that they're seeing antibodies made against those proteins. So let me try to explain how a Western blot is done. So back then, the test you had done was a Western blot. What we do in a Western blot is we grow, LabCorp would grow one strain of Lyme, even though we recognize 8 different strains can cause it in the US. They only grow one. And we grow that strain in a lab, and then we kill it, and we take its proteins that are found on the covering. And then we take those proteins and we put them on a cellulose test strip and we run electricity through it. And that causes the proteins to distribute or land in different places based on what they weigh. So for instance, there's a group of proteins that land at called protein 41 that land at this same position. There's another group that land at the same position called protein 39, okay? And then what we do is we add antibodies to see if they will attach to proteins found on your test strip, antibodies made against these different proteins. And then we add a coloring agent and we see, do you have antibodies based on whether you've got color at these different positions compared to a controlled strip, all right? So what this means is that they're seeing, abnormal means that they're seeing that you have antibodies against protein 39 and against protein 41, and you're not supposed to have antibodies against those. So that's why they're calling it abnormal, all right? Now, LabCorp's diagnostic criterion at that time, and still is based on the Centers for Disease Control and FDA criterion, which basically said on an IgG, you actually need to have antibodies against 5 different of the 10 proteins that they test against, all right? Newer criterion advocated by IGenex and other labs basically says an IgG should be interpreted if it's positive if you have antibodies against protein 25 or 23-25, 31, 34, 39, 41, or 83-93. Now, LabCorp's method of doing a Western blot would not even test to see if you have antibodies against 31 and 34. They don't even look for it, okay? More recently, IGenex has been selling a test kit to labs, and to sell that test kit, their test kit to labs, they now have to have FDA approval. With FDA approval, they had to get approval of their interpretation criterion. And for the first time, the FDA has improved interpretation criterion that says a Lyme disease test is positive on an IgG if you have antibodies against 2 of the following 6. 23-25 is 1, 31, 34, 39, 41, or 83-93. So you have a positive test because you have positivity against the 41 and 39. Okay. David, does that answer your question for you?
I think so, Dr. Ross. I'm trying to get to the root cause of why I've had upper right quadrant pain.
Yeah.
Since 2010. Perhaps I got my original diagnosis from an IGenex test way back then.
Yeah.
Maybe for another one from them. Do you think so?
I'm sorry, say it again.
Maybe it's time for another IGenex test.
Well, once a test is positive, it's positive. The trouble with, again, retesting, as I explained earlier tonight, doesn't give us any meaningful information. It doesn't tell you whether you're better or not. And antibodies can even remain positive even after a germ is gone. So if you go and test and it's negative, it doesn't prove the germ is out of you. It just means your immune system may be too suppressed to make antibodies, right? Or it is gone, right? But you can't say just based on looking at a negative test. And if new testing comes back and says it's positive, well, you've already had an old test that said it was positive, and sometimes IgG antibodies don't go away, even when the germ is under control. So I don't know there's any benefit in doing a retest on that.
And my immune system is suffering. We're working on reasons for the LDN. Speaking of which, could I ask you a question about, you made a comment on the Ketotifen and the LDN earlier.
Yeah.
How's KPV in your store? You have a capsule and a spray.
I'm sorry, say your question again.
In your store, your KPV peptides, you have a capsule or you have a spray.
Right.
75 have a tough time with capsules.
But you could do the spray. Both of those products are interchangeable. They both work equally as well.
That's what I was getting. Perfect. Thank you very much. I appreciate it.
Good luck to you. All right, everyone. That's it for me for tonight. Good being with you here tonight. Next week, we will go again next Thursday. So when I send out the notification tomorrow, I'll also have a link for you to sign up for next week's webinar. Again, give me till about 9 or 9:30 a.m. Texas time to get that email notice out to you and to have the video edited up and ready for you to review. Okay. All right. Good night, everyone.
Thank you so much.
You're welcome. Bye-bye.